Today's episode will be on amoxicillin, brand name Amoxil. So amoxicillin has a lot of different indications. Unfortunately, I'm not going to go over all of them. I'm going to try and cover the main indications that you most commonly see it used in. It's used in ear, nose, and throat infections, in urinary tract infections, in H. pylori eradication, in lower respiratory tract infections, including pneumonia. It's used in acute bacterial rhinosinusitis, and it's also used in skin and skin structure, specifically the soft tissue infections. Just to briefly touch upon some of the off-label uses, it's used in anthrax, in prophylaxis in asplenia, in endocarditis. It's used in treating Lyme disease, periodontitis, and prosthetic joint infections. So there are many different dosage forms for amoxicillin. The main ones are capsules, suspension for reconstitution, tablets, and chewable tablets. Capsules come in 250 mg and 500 mg. Suspensions come in 125 mg per 5 milliliters, and 250 mg per 5 milliliters, and 400 mg per 5 milliliters. Tablets come in 500 milligrams and in 875 milligrams. The chewable tablets come in 125 milligram and 250 milligram tablets. So dosing in adults and geriatrics, the general dosing is typically between 500 milligrams and 1,000 milligrams every 8 to 12 hours. Specifically in ear infections, it's 500 milligrams every 8 hours or 875 milligrams every 12 hours for a duration of 5 to 7 days. In the treatment of pneumonia, specifically community-acquired, outpatient, and as empiric therapy, amoxicillin is given at 1,000 milligrams 3 times daily for 5 days minimum. In treating acute bacterial rhinosinusitis, 500 milligrams is given every 8 hours or 875 milligrams every 12 hours for 5 to 7 days. In the eradication of H. pylori, 1 gram is given twice daily in combination with clarithromycin 500 milligrams twice daily and a standard or double dose of some type of proton pump inhibitor, and that's given for 14 days. In SSTI, 500 milligrams given 3 times daily or 875 milligrams twice daily for 5 days. 14 days can be the extended duration for patients where there's a slow response or if there's a severe infection or some type of immunosuppression. Specifically in streptococcal pharyngitis, group A specifically, 500 milligrams given twice daily or 1,000 milligrams daily for 10 days. In treating UTIs, 500 milligrams every 8 hours or 875 milligrams every 12 hours for 4 to 7 days. 5 days of acute and uncomplicated and simple. So in dosing in pediatrics, the general dosing for infants that are less than or equal to 3 months in mild to moderate infections, the dosing is dosed off weight. The dose is 25 to 50 milligrams per kilogram per day, divided into doses every 8 hours, and that's according to Red Book. The max dosing is 30 milligrams per kilogram per day, at least according to the manufacturer. In regards to infants greater than 3 months and children and adolescents, if they have some type of mild to moderate infection, it's also dosed by weight. The dosing is 25 to 50 milligrams per kilogram per day, divided into doses every 8 hours, with a max 500 milligrams per dose, according to Red Book. The other dosing, it's also based on weight. It's 20 to 40 milligrams per kilogram per day, divided into doses every 12 hours, with a max of 875 milligrams per dose, at least according to the manufacturer on that as well. For infants greater than 3 months and in children and adolescents with severe infections, the dosing range is now between 80 and 100 milligrams per kilogram per day, divided every 8 hours, with a max of 500 milligrams per dose, and that's according to Red Book. So in treating the pediatric population with ear infections, between infants that are greater than or equal to 2 months and for children, the dosing is between 80 and 90 milligrams per kilogram per day, divided every 12 hours. So the duration of therapy varies for those that are under 2 years old, or if there are severe symptoms, the duration is for 10 days. If there are mild to moderate symptoms, the duration is between 5 and 7 days. For ages between 2 and 5 years, for mild or moderate, it's 7 days. For children that are greater than or equal to 6 years, with mild to moderate symptoms, the duration is between 5 and 7 days. The suggested max dose is 4,000 milligrams per day. So in treating the pediatric population with pneumonia, specifically community-acquired, outpatient, and empiric, for infants that are greater than or equal to 3 months, in children and adolescents, they are treated empirically at 90 milligrams per kilogram per day, divided every 12 hours, with a max 4,000 milligrams per day. In treating children with acute rhinosinusitis, for those that are greater than or equal to 2 years old and in adolescents, when uncomplicated and mild to moderate, the lower end of the dosing is 45 milligrams per kilogram per day, divided every 12 hours. The higher end is 80 and 90 milligrams per kilogram per day, divided every 12 hours, with a max of 2,000 milligrams per dose. Mechanism of action and pharmacology. Amoxicillin works through the inhibition of bacterial cell wall synthesis. It binds to penicillin-binding proteins, or PBPs, which inhibit final cell wall synthesis, and then that allows autolytic enzymes to cause the bacteria to lyse. The absorption of amoxicillin is pretty rapid. It's distributed through a lot of different tissues, such as liver, lungs, prostate, muscle, middle ear, sinuses, and bone. There's poor penetration into the cerebrospinal fluid, or the CSF. Amoxicillin is excreted in the urine. 60% of it is in the urine. Peak serum levels is typically between the first 1 or 2 hours, with a half-life between 60 and 90 minutes. Side effects. There's nausea, vomiting and diarrhea, headache, and skin rash. So there's a few things to be kind of cautious about. The main one is the penicillin hypersensitivity reactions, or essentially that anaphylactic shock that could occur to people that are allergic to penicillins. The other concern is for C. diff. The concern is also for fungal superinfections, so essentially fungal and bacterial superinfections. Drug interactions. So acetaminophen may increase penicillin serum concentrations. Penicillins may increase methotrexate serum concentrations. Penicillin may increase warfarin's anticoagulant effects. Monitoring parameters. It may interfere with urinary glucose tests, as well as the other things to monitor is renal function and hepatic functions. Patient counseling information. So obviously, it's used to treat some type of infection. Another important thing to mention to them is that they have to complete the full course. Another important thing to be aware of is in pregnancy, it does cross the placenta, but the risk category has been risk factor B.